So I am delighted to have the opportunity to deliver my first annual report. Actually, my annual report, not first, my fourth annual report as the president of the NAM. Before I begin, I'd like to take a moment to acknowledge the past presidents of the National Academy of Medicine who are present: Harvey Feinberg, Sam Thier, and David Hamburg. So, good morning and welcome to our distinguished members and esteemed guests. As I said, it's my pleasure to deliver my fourth annual address today as your president. First, I'd like to congratulate 3 NAM members who are receiving the 2018 Nobel Prizes in Medicine, Chemistry, and Peace. James Allison for his work on cancer immunotherapy, Francis Arnaud for work with directed evolution of enzymes, and Dennis Mukwege for his effort to end the use of sexual violence as a weapon of war. We are so very proud of them, as they have all made lasting, life-changing impacts on the world. So I think we should give them a round of applause. Turning now to this year's presidential address, I'd like to begin with a quote. "The tragedy of life is often not in our failure, but rather in our complacency, not in doing too much, but rather in our doing too little, not in our living above our ability, but rather in our living below our capacities." These words from Benjamin Mays, often called the father of modern civil rights movement and a mentor to Martin Luther King Jr., should be a rallying cry to all of us who have devoted our careers to health and medicine. Like Dennis Mukwege, who fought tirelessly against sexual violence in the Democratic Republic of Congo, we here cannot afford to be complacent today, not in 2018, to do too little or to fail to fully take advantage of the best that science and evidence has to offer. The stakes are simply too high. We're dealing with public health crises on multiple fronts. Consider that the overall life expectancy in the U.S. has fallen for 2 consecutive years, representing the first ever decline since the 1960s. Many experts attribute this fall, in part, to a sharp increase in the deaths of despair, lives lost to suicide, alcohol, or drug abuse. Last year, drug overdoses alone, many of them opioid-related, killed about 72,000 Americans. Consider, too, that we continue to see disturbing health disparities among Americans based on factors such as where they live, socioeconomic characteristics, or racial or ethnic identities. For example, in the U.S., which has the highest rate of deaths related to pregnancy and childbirth in the developed world, Black women are almost 4 times as likely to die from pregnancy-related causes as white women. As we grapple with these public health crises, we also face challenges on other fronts. There's still much uncertainty about the Affordable Care Act, public trust in science is fading, and evidence is being ignored. And just when we need them most, too many researchers and clinicians are not reaching their full potential. Burnout, leaving altogether because of overwork, exclusionary policies, and harassment. So as Dr. Mays so eloquently stated, now is not the time for complacency. Now is the time for action. Action, of course, based on science and evidence. The National Academy of Medicine is working hard on every one of these issues. Our work on the opioid epidemic is a powerful example. Since 1999, opioid-related deaths have more than quadrupled. The crisis is taking too many lives, shattered too many families, and ravaged too many communities around the U.S. Although currently there are many efforts occurring at multiple levels. There's certainly a lot of funding. One major barrier to combating the crisis is the fragmentation of efforts, a lack of coordination and collective action. Indeed, given the complexity of the issues, solutions have to be multi-sectoral and collective. No single agency or entity can do it alone. This is why in this July, the NAM initiated a truly unique opioid action collaborative, partnering with the Aspen Institute to combat the opioid epidemic and galvanize action. We brought together all the major stakeholders to collectively develop coordinated, focused efforts to tackle the epidemic based on evidence of what works. More than 35 organizations, including all the agencies and the leadership of HHS, state and local officials, healthcare providers, education accreditation, pharmacy, nursing, academia, have come together to form a public-private partnership. Our collaborator is co-chaired by Dr. Brett Giwar, the Assistant Secretary of Health and the Senior Advisor to HHS for opioid policy and mental health. He is the czar, if you will. As well as Ruth Katz of the Aspen Institute and Jonathan Perlin of HCA Healthcare. This collaborator is working collectively across sectors in the following areas. First, establishing a coordinated education curriculum. To date, education training has been highly fragmented and variable. This effort will involve educators, accrediting institutions, and coordinate among undergraduate, graduate, and continuing medical education, as well as cross-health professions, nursing, pharmacy, dentistry, and others. Second, assisting FDA in defining opioid prescription guidelines for a range of indications and ensuring that these guidelines successfully translated into workflow. Achieving this will require the collaborative efforts of medical specialty societies, clinicians, pharmacy, and regulators alike. Third, addressing more effective treatment and prevention and recovery. These require the collaboration of policymakers, care providers, law enforcement, social service at all levels to achieve progress, and a need to build community-based capacity and care models. And last but not the least, research and data. There's a need to understand what works and what doesn't, and to address issues and promote solutions related to data access, sharing, transparency, and interoperability. So we have done a lot of work, and we have a lot of work ahead of us. But the message I want to give you is this is truly cross-sectorial collaborative work, government, academia, organizations, and we convene, and the stakeholders identify these major areas to work on and collectively find solutions. So using the same collaborative model approach, we're taking on another issue that affects the entire health and medical profession, and that is clinician burnout. The statistics are startling. More than 50% of physicians are experiencing symptoms of burnout. As many as 30% of primary care nurses experience emotional exhaustion, and 24% of ICU nurses have PTSD. That is just a terrible burden for these individuals, but it's also bad for the quality of patient care. In the last few years, the medical community have started to recognize this problem, and many hospitals, medical centers, training programs have all sprung into action. But these actions are developed in isolation, and it's not clear what interventions are working well and which are not. So in response, we launched the Action Collaborative on Clinician Well-Being and Resilience, a network of more than 60 organizations committed to developing system-level solutions. Our collaborative unites the organizations already developing individual solutions while bringing new key stakeholders to the table. They are policymakers, payers, health IT vendors, particularly of electronic health record. We're already making a lot of progress. We've developed 5 working groups who have worked hard for last year and a half at addressing a multitude of factors that contribute to clinician burnout: regulatory environment, reimbursement environment, digital health environment, organizational leadership, and the learning environment. We're working to elevate this issue to national attention. We have launched a consensus study to recommend systemic changes to counteract clinician burnout across the entire healthcare system. You know, nearly 20 years ago, the IOM launched the landmark studies To Err is Human and Crossing the Quality Chasm, which, as you know, have driven transformative changes in healthcare delivery. We hope that an academic's report on clinician well-being will have a similar impact for the field. Another area that's so important to us is health equity. Through our multi-year Culture of Health program, sponsored by the Robert Wood Johnson Foundation, we're working to identify strategies to create and sustain conditions that support equitably good health for everyone in America. In the first 3 years, we have released an important report, as you can see in this slide, Community in Action, Pathways to Health Equity, and 3 more study reports are now currently underway. We've held many public workshops, community events, and tools for stakeholders. As NAM member and former head of RWJ Foundation, Risa Lavisa-Mori wrote in an op-ed, and I quote, "While your health is certainly an individual responsibility, that is not where responsibility ends. The responsibility for promoting health and equitable opportunity to achieve it lies with all of us." Indeed, we all have the responsibility for fighting for better health and healthcare, especially now. As I mentioned, there's still a lot of uncertainty around the future of the ACA, given the many changes enacted by the current administration and in many states. But you know, whatever direction, we can't afford to lose sight on the values and priorities which our healthcare system must provide. And they're laid out in NAM's Vital Directions for Health and Healthcare initiative, launched a couple of years ago, that you know about. It involved 150 experts authoring 20 policy papers on the important directions of healthcare. The priorities are pay for value, empower people, activate communities, and connect care. Through this initiative, we are working hard to refocus policy discussions and conversations in the nation, and especially with the policy makers, around issues that matter most to our people. Many of the goals of the Vital Direction Initiative are now carried forward through the NAM's Leadership Consortium for Value and Science-Driven Healthcare System, led by Mike McGuinness and Mark McClellan. This is a trusted forum for national leaders in health and healthcare to work cooperatively. So far, I've focused a lot on the difficult challenges, but let's not forget the good news. We're working in an amazing era of scientific discovery and potential for revolutionary breakthrough. It is quite extraordinary. We're witnessing rapid scientific technological progress in areas of genome editing, regenerative medicine, immunotherapy, synthetic biology, 3D printing, and more. All hold great promise for future innovation and innovative therapies. Furthermore, advances in digital technology, big data, and AI may improve healthcare by helping clinicians to make better diagnosis and treatment decisions, and by transforming the way that patients make personal and healthcare decisions. So, as a premier academy of medicine, we consider that an important part of our mission is to stimulate science and innovation and to address unmet medical needs, especially when we consider the rise of chronic disease and rapid population aging. Now, the grand challenge for healthy longevity, co-chaired by Bob Horvitz and Tachi Yamada, intends to do just that. By 2050, more than 1.6 billion people in the world will be 65 years or older, double the size of population today, with significant increases in Alzheimer's and, of course, other age-related diseases. We urgently need solutions from research and policy that will keep us healthy, productive, functional, and free of disease as we age. Without action, this could put significant strains on economies, healthcare system, and societies around the world. Our Healthy Longevity Challenge aims to address this important issue through an international commission known as the Roadmap, which you see on the right side. The Roadmap will deliver a comprehensive assessment of the challenges and opportunities presented by global aging, as well as promising solutions and necessary directions for improving health, productivity, and quality of life. And the roadmap will be used to contextualize for each different countries to move forward with policy changes and other actions. Our grand challenge also stimulates research through a series of inducement prizes and awards to spur innovation, as shown on the left-hand side. We plan to create Catalyst Awards to incentivize a large base of innovators, researchers. We use the Gates Foundation Grand Challenge Exploration model as a model that Tachi Yamada had previously. With these $50,000 awards, we plan to support several hundred new, bold, and potentially transformative ideas, and we'll do that for a few years. They can originate from any field such as biology, engineering, social sciences, or better still, a combination of fields. Research innovators can ultimately compete for a Grand Challenge Incentive Award, which we have raised money for, of $2 to $5 million each, which will be given to breakthrough achievement that dramatically improves human health span. Yesterday, at the interest group on biology of aging, we had a phenomenal turnout and discussion. There was tremendous enthusiasm to go forward with this Grand Challenge. We plan to launch the NAM Grand Challenge in Health Longevity in early to mid-2019 as a global initiative with a committed participation of up to 30 countries, including Japan, Singapore, UK, US, Taiwan, Hong Kong, and the EU, who are joining this NAM global initiative by supporting regional competitions for Catalyst Award, all under the umbrella of the NAM Grand Challenge. So we're off for a phenomenal start. Just as we need a robust biomedical research enterprise that will produce the new medicine and technology, we also have to ensure that these breakthroughs benefit all of society and do not exacerbate the inequities we see today. As I wrote in a recent focus paper in Science Translational Medicine, for every new innovation and technology in health, we need to address the larger issues of affordability, access, and equity, and the potential impact on society. For example, the genome editing, which offers great promise for treating and curing disease, also raises complex social, societal, and ethical questions. In 2016, the NAM, along with National Academy of Science, and with the Royal Society and the Chinese Academy of Science, convened a first international summit on this topic right here in this auditorium. In 2017, we issued a timely report that examined this issue with specific recommendations. Next month, we hold our second international summit, chaired by David Baltimore in Hong Kong, co-hosted with NAS, Academy of Science in Hong Kong, and the Royal Society. So we need to maximize the benefits of scientific medical breakthroughs and mitigate the risk. To do so, we need to develop policies, norms, standards, incentives that shape development and deployment of these new technology. I feel strongly, and I know you do too, as the premier academy in health and science and medicine, we have an obligation to lead and address these important issues. Indeed, our commitment is clearly stated, as you can see in this slide, in our strategic plan, goal number 3 that you helped develop. Accordingly, we are now forming a committee on emerging science, technology, and innovation at the NAM, which will work across the national academies, focus, however, on health and medicine, which will examine cutting-edge innovations and technology in health and medicine through the lens of their potential societal implications. As a premier science-based academy, we also have a duty to speak up when we see that science is being ignored or misused. And just as committed to making our voice heard, especially when people's lives are at stake. Our voice, a voice of reason, of objectivity, of evidence-based solution is needed more than ever. So it became clear, for example, that migrant children were being separated from their families at the US-Mexico border as part of a new immigration policy. We knew the Academy has to speak up. Together with the NAS President Marshall McNutt and NAE President Dan Moat, we issued a statement calling for an immediate halt to this practice, citing decades of evidence from National Academy's report that indicate how serious and lasting the damage could be for these children. In fact, I tweeted, as shown here, on this issue based on my own personal experience, being a refugee and immigrant from China. We can't stay silent on these issues when we know that science and research have answers that will help. Gun violence is another example. At least 15,000 people died because of guns last year in the US, and that number excluded suicide. Gun violence is a public health problem that we can do something about. And before we can build solutions, we need to carry out a comprehensive public health research agenda on prevention. In fact, such an agenda was outlined in the 2013 IOM report, chaired by our member, Alan Leshner. Unfortunately, the fraud politics of the issue have prohibited efforts of CDC and others to support or conduct research in this area. In response to this devastating mass shooting last year, Alan Leshner, Mark Rosenberg, and I co-wrote 3 editorials reminding the policymakers about the IOM report and arguing for federal funding for a more comprehensive agenda on gun violence. They, as you see, appeared in Washington Post, Science Magazine, and the Annals of Internal Medicine. I'm pleased to say that has been a small but important victory on this front. In the 2018 Omnibus funding bill, Congress included explicit language to make it clear that federal support in researching violence is allowable, clearing up a long-standing misunderstanding of the Dickey Amendment that have resulted in the prohibition of research funding for gun violence for many years. Unfortunately, Congress has yet to allocate funding to CDC and others for this, but we'll keep working on it. As an academy, it's also our duty to be a leader and speak up on pressing issues within science and medicine, and especially those that threaten our integrity. More than 2 years ago, well before the Me Too movement garnered national attention, the National Academy's Committee on Women in Science, Engineering, Medicine initiated a study on sexual harassment in academic science, engineering, and medicine. This timely report, released 3 months ago, charges academic research and professional institutions, including the academies, to take responsibility by creating a climate of inclusion, diversity, and respect. We, all of us, have a very important role to play by raising awareness, galvanizing others to follow our lead. Take action when needed. We need to disseminate this report findings and engage leaders to drive change. So it's a privilege for me to participate along with Paula Johnson, an NAM member, co-chair of sexual harassment study, in a forum at the Aspen Ideas Festival, and we co-authored editorial in the New England Journal of Medicine to highlight this issue, to get attention of the health and medical profession. But we're not stopping here. On November the 9th, the National Academies together will convene a national convocation of academic leaders to discuss what we can do together to end sexual harassment in our own institutions. So members, going forward, you can count on NAM will work with all of you to continue to speak up for science and evidence-based policy. It is simply the right thing to do. I'm really proud of all that we've accomplished together. In the past few years, we've done so much. But it's not time to rest on our laurels. We need to be both vigilant and visionary. We must maintain an unwavering commitment to our core values, but also position ourselves as a proactive leader in a rapidly changing world. Therefore, working with all of you, we recently launched a new strategic plan to position our organization for maximum impact in the coming years. I'm grateful to so many of you who have participated in this planning process. Simply put, our vision is a healthier future for everyone. We have developed a new mission statement that says to improve health for all by advancing science, accelerating health equity, and providing independent, authoritative, and trusted advice nationally and globally. Further, in everything we do, we will adhere to our core values. As you can see in this slide, we have identified 4 foundational activities that will be essential for achieving our goals. I'd like to discuss briefly 3 strategic goals, those 3 that we have set for ourselves to increase our impact and bring around transformational changes in health and medicine. First, goal 1. Our first goal is to actively identify, address critical issues, to lead and inspire action on bold ideas to impact science, medicine domestically and globally. Well, I think I've already discussed many examples of how we're meeting this goal. Our work on opioids, clinician well-being, cultural health, and to inspire and lead grand challenge healthy longevity, to name a few. But to be even more proactive for the future, we created a new NAM committee chaired by Keith Yamamoto, tasked with identifying emerging opportunities in basic translational sciences and illuminating new and unrecognized critical issues. Second goal is to diversify and activate membership of the Academy and engage emerging leaders and scholars to enhance our leadership capacity. Recently, we have increased the total number of new members who can be elected in any given year. We talked about that in the business meeting yesterday, and we appointed a diversity committee to help us. I'd like to thank the diversity committee members led by Jane Henney. They are Elena Fontes-Affleck, Narif Shah, Reynard Kington, Nancy Andrews, and Sandy Schwartz. They have put so much time and effort into this issue. But you know, we're already seeing some progress. Today, we're going to formally announce the newest class of 2018 NAM members. This is the most diverse class yet. 42% are women, 28% from minority group, and 24% are age 50 and under. So we're making progress. Of course, we recognize we have much more work to do, and we're totally committed to doing this. We're also considering how to modernize our election process. We discussed that at the business meeting yesterday. Many of you have raised this issue with me, and frankly, I think it is time for us to at least look at our process and our sections. We've done pretty much election pretty much the same way for at least 40 years now, and our current membership sections are based on traditional departmental structures and do not necessarily reflect new emerging areas of science and medicine today. So we need to design a process that recognizes these changes. Let me say that we're not rushing to do this without engagement, input, and thoughtfulness. Definitely it would take some time, but I do think that we need to begin to think along those directions. I also want to engage our members even more. I've really enjoyed meeting with many of you at regional meetings, getting to know you, what's on your mind. In the past year, I held 14 regional meetings throughout the country, also ones in Mexico, UK, and China, meeting our members in those countries. I found these gatherings extremely helpful. We're also finding new ways to keep you informed of key initiatives and how we're responding to your concerns and to critical issues. We have also started to reach out to the younger generation through our Emerging Leaders in Health and Medicine program. We launched in the fall of 2016. We named more than 20 exceptional early to mid-career individuals women and men working in biomedical science, healthcare delivery, health policy-related fields. I introduced you to them earlier today. They're all here attending our meeting, and their energy they lend their energy and expertise to a variety of issues across National Academy. I think if they think they're learning a lot from us, we're learning even more from them. In April 2019, we'll host the inaugural Emerging Leaders Forum, a two-day event that they are designing to engage even a broader range of all of you, along with early and mid-career participants. I truly look forward to this. So, as you know, members are really the lifeblood of the Academy. And being elected to NAM is quite an honor. It's an honor that comes with great responsibility. As individuals, all of us must adhere to the highest ethical standard and conduct ourselves with the utmost professional integrity. Sexual harassment or intimidation of subordinates or peers is never acceptable. Fabrication of data or plagiarism is never acceptable. The NAM is taking these issues very seriously. Along with NAS and NAE, we're developing codes of conduct for our memberships. We discussed these issues at yesterday's business meeting, including establishing a formal mechanism by which we will address misconduct by individual members. Of course, we also talk about a rigorous and transparent procedure so that everybody's rights are being protected. But I think you agree with me, this is the right thing to do. Our third goal is to build leadership capacity across diverse disciplines to shape the future of health and medicine. As I mentioned earlier, we need to be prepared to embrace the new science and align our work with the shape and pace of science today. This is why we're establishing a cross-academies Committee on Convergence Science. A 2016 report from the MIT, shown up there, described convergence science as the future of health. Convergent science is described as an approach to problem solving that integrates expertise from life science with physical, mathematical, computation science, as well as engineering, merging areas of knowledge from multiple fields to address specific challenges. Next week, we'll have a big meeting on convergence science convened by the three academies. We embrace convergence science at NAM because we believe that will transform health and medicine. However, I also believe the current definition on convergence science, focusing on biology, physical, mathematical, engineering science, is just too narrow. As pointed out in a recent paper in Lancet, we have to expand this definition of convergence for all areas of health. For example, we need to reimagine population health in terms of convergence. We need to draw upon social, behavioral, economic, data, legal, political sciences. They're all sciences, to name a few, to converge our research, policy, and implementation that can influence population outcome. So this is really exciting. But in this goal also is the need to address impact on society. As already discussed earlier in my remarks, this strategic goal number 3 will also address science technology, the impact on future of health, but also implications, social, ethical, and societal issues. So, I'm sure you agree that in 3 short years since we became Academy, we have been far from complacent. We have established our identity as the nation's premier advisor on matters that relate to health and medicine. We're tackling really tough issues that matter in society now and in the future. As IOM and now NAM, we'll be celebrating 50th anniversary of our founding in 2020. This provides the perfect opportunity not only to celebrate all that we've accomplished together, but also begin to chart a course for the next 50 years of U.S. and global leadership in health and medicine. In order to continue our impressive trajectory and impact as a world-class academy, we'll need robust resources and support. We're very grateful that federal government continues to seek us out for objective advice, but we can't rely solely on the government to support some of the really important work that needs to be done. We want to be proactive in identifying and tackling issues that really will have an impact and lay the foundations for better health for everyone. And we need resources to do that. That is why we've started a major development campaign to raise $100 million over the next 7 years. We're just beginning now the silent phase, and we plan to launch the public phase in 2020, coincide with the 50th anniversary. The goal, of course, 100 million is a very ambitious goal, to be sure, but I think it's entirely within the realm of the possible. And it's really necessary. We want to continue doing the excellent work that we do. You certainly will be hearing much more about this campaign from me and others in the coming months. I've covered a lot of ground today, but let me conclude by saying a heartfelt thank you. Really, thank you. I'm so grateful to our members, to our sponsoring organizations, to our volunteers and members of the public who support us. It is because of your commitment, your dedication, your hard work that we have accomplished all that we have. You know, there's an old Chinese proverb, a single tree does not make a forest. A single string cannot make music. We can accomplish a lot as individuals, but when we come together, believe me, through the Academy of Medicine and the work towards common goals, we can make seemingly impossible possible. Through our work, we are shaping not only our own destiny, but that of future generations here around the world. So for me, it's a privilege to serve you as the NAM president for the past 3 years, and I'm president for 1. Together, we accomplished so much. We've established a distinct identity for NAM. We have a new strategic plan. We have launched multiple key initiatives. We'll be celebrating 5th anniversary. We're starting a $100 million dividend campaign. I look forward to serving all of you for the next several years to ensure the realization of our plans and reaching our full potential as the world's leading academy of medicine. Thank you very much.